So now that we can talk about everything we couldn't say, another thing I need to bring up is how I believe Medicare and Medicaid were weaponized against hospitals and nursing homes to force compliance and vaccination amongst healthcare workers. So I have this written down. I'm going to read this to you. In the CMS Omnibus COVID-19 Healthcare Staff Vaccination Interim Final Rule states on page 14, paragraph 1, you can look this up yourself. Basically, it explains penalties that are going to occur if the facilities don't have compliance with this rule, meaning if they have unvaccinated workers, this is going to have some consequences. So these are the consequences. It says the consequences to basically having unvaccinated workers includes civil monetary penalties, denial of payment, and even the termination from Medicare and Medicaid program as a final measure. So another thing I want to point out to you is, according to the Congressional Research Service, as of September 19th, 2023, page 1, figure 1, you can look this up yourself, 65% of nursing home funding comes from Medicare and Medicaid. 28.6% comes from private pay. So basically, if there was incompliance among nursing homes, healthcare facilities to this, they were basically threatening to cut off Medicare and Medicaid funding, meaning this is a death punch to these facilities. Now, so I work in a lot of rural areas where you can't just fire a nurse and just pick one up. You know, I was working in nursing homes where the population were 200 people. You know, there was 70 people in the nursing homes. These were very small nursing homes. So the nursing home then had to decide, okay, well, if we fire these nurses, these CNAs, what have you, because they're unvaccinated, we're going to close because we can't staff. Or we're going to keep these workers and then lose our funding from Medicare and Medicaid and then only be operating off of 28.6% income, and we're going to close anyway. All for a vaccine that was said to stop the virus, which it never did, and they knew that it didn't. This was wrong, and this was something that was not talked about. And so now that we can, it's time to talk about everything that we couldn't say.